Dr. Sanjay Gupta is on the line with us this morning. Man, I have seen you on late and up early, and I know I work a lot of hours, but you are putting in the time. And, man, we are grateful with such great information that you have, Sanjay. So thank you for coming on.
It's my pleasure. Thank you.
It's early here still on the West Coast. I'm curious to know what has happened overnight that you're thinking about.
I think one of the biggest things that we're thinking about is what is likely to happen this next week, because that's going to be the end of this 15 days, which a lot of people have heard about, Ryan. It's a 15-day pause, for the nation to sort of say, everyone stay at home as much as possible. And I think the impression that you got when you first heard about this 15-day pause was that it was not necessarily, that at 15 days it might be reassessed and we'd go from there. Public health officials, I think, are really signaling that this needs to go on longer, not forever, but longer, a few more weeks. But you're also hearing sort of these hints that because of the economy, people want to open it up again. And I think that there's this real grappling that's going on between these two things right now in real time. So that's a big thing. And the other big thing is New York, Ryan. I know where you spend a lot of time. I mean, it is 1/5 of the cases in the entire world right now are in New York. I mean, that is a city and a state city primarily that is really accelerating the growth in terms of cases, doubling every 2 to 2.5 days over there. So they really have to put some things in place to be able to handle this over the next week, Ryan.
Dr. Sanjay Gupta with us now from CNN. What about the medication we're hearing about in the press conferences, in the news, things that are being given to people now? What is the expectation? When will we know if that's working or not? I know the vaccine's a different track, but some of these medications that they're trying.
Well, there may be some hopefulness here. There's about 20 different medications that are currently in trials. And some of them have been in trials since about a week after the first patient was diagnosed. And some of the trials are happening on medications that already exist, which is good, because these are medications that you know how to develop. These medications, you already kind of know the side effects, the safety, sort of profile of these. So you can accelerate that process. One of them that's been getting a lot of attention is chloroquine. It's a malaria drug. It's been around for nearly 90 years. We don't know if it works or not. There was some lab evidence during SARS, which was 17 years ago, but a similar virus, which is why it's relevant. Some laboratory evidence that there could be some benefit in a very small study in humans of about 20 patients. So, but they got to test it, and that trial starting today, Ryan, in New York, 10,000 treatments going out. And that clinical trial starting today. So, you got to give credit because these trials are happening fast. Having said that, the answer to your question, I think, is still, measured in weeks and months in terms of when we might have some good data on this, not days, unfortunately.
How much weight do you put on looking at what has happened in Italy and in other parts of the world where this has been very drastic?
Well, a lot, because, this is a new virus, so you can't look throughout history to sort of say, well, how did this behave last time or 10 years ago? The only time we really have is over the last 3 months. So we're all, everybody has to be a bit humble here in terms of being dogmatic about this. Nobody really knows. Having said that, Italy is what everyone is pointing to as a very severe scenario, not necessarily a worst case, but maybe a worst case scenario. Let me give you the flip side, Ryan, is that you look at China, you look at South Korea, and they look like they've come out the other side of this. We don't know for sure, but it really looks that way. And you start to say, well, how long were some of these measures in place that we're talking about? Mm-hmm. And the curve over there was sort of around 8 weeks, a long time, but not interminable by any means either. Right. So, and South Korea is sort of the same thing. Here's what I think about when I think of Italy, and I think this is probably the most important thing for folks here now in this country, is that I think part of the reason it has been so severe over there in Italy is because the medical system just became overwhelmed. The virus in and of itself is a bad virus. But I think the reason the death rates are so much higher in some parts of the world is because the medical systems become overwhelmed. We in the United States have one of the greatest medical systems in the world, but it only has a certain capacity.
Mm-hmm.
So when you look at all these things that people are being asked to do, Ryan, stay home. I know you guys have been broadcasting from home now. I mean, all that, it does make a difference. We've seen that make a difference in other countries, but it also slows down the pace at which people go to the hospital. You talk to Governor Cuomo, which I've been doing regularly. I talk to public health officials from the coronavirus task force. They say the most important thing right now is probably ventilators because, the testing is important. Personal protective equipment is very important. But the situation where someone needs to be in a breathing machine and can't get one, that's tragic.
That's a real problem.
That shouldn't happen.
Yeah.
And that's what they're trying to fix.
Sanjay Gupta is with us. A couple of things I just want to clarify for our listeners. I read something and I just wonder, this new article talking about loss of smell, taste, things like that, being a telltale sign that you may have the virus. What do you say to that?
I think that's very interesting and very much worth paying attention to. I don't think that's sort of a fringe oddity sort of thing. It is true that sometimes people can have loss of smell as a symptom of this and even a first symptom of this. And it can even sometimes be the only symptom, meaning that it's not just because of a runny nose or congestion. People will just lose their sense of smell. And it's oftentimes people will recognize first thing in the morning, for example, smell their coffee or something that has a distinctive smell, and they can't smell it. Now, if what I will say is that if you are hearing this and you think, well, that's me, I haven't been able to smell as well lately, it doesn't mean that you necessarily need to rush out and get a test either. I think that, if you develop symptoms that are more significant, then you should call your doctor and go in and get tested. But likely this, what they call anosmia, which is the medical term for loss of smell, will be short-lived. It should return at some point. That's what they're seeing in some of these patients around the world. So all of these are clues. Another important clue I saw just this past week, guys, was that originally this was thought to be entirely a respiratory syndrome. The predominant symptoms being fever, 100.4, dry cough, and shortness of breath. But they're also seeing that there's digestive symptoms here, that sometimes people will have GI symptoms of abdominal pain or a loss of appetite, diarrhea or something as their first symptom. Again, just pay attention to it. It doesn't mean you have to rush in and get tested. One rule of thumb, I'll just say, is that just rewind a year. Go back to last year. If you're having symptoms and it was a year ago, would you have called the doctor? Would you have gone to the hospital? If the answer was no then just the answer should be no now. It'll be safer for you to be at home, less likely for you to get infected if you're not, and less likely for you to spread it.
What about Tylenol versus Advil? I was reading conflicting articles actually about that, saying that maybe we shouldn't be taking Advil right now.
Yeah, this has been a lot of questions around this, and there was some medical. There was a couple of journal articles about this. We've done a lot of digging into this, and from the World Health Organization and the CDC, they really don't find that there's any problem with people taking Advil, ibuprofen, or what are called the non-steroidal anti-inflammatory drugs. I think part of the concern was that those medications, they act like steroids. They're non-steroidals, but steroids, can suppress your immune system a bit. And the concern was, would these do that as well? But the answer is they don't do it significantly enough for this to be a problem. If you're somebody who already has a weakened immune system, then Tylenol may be a better bet for you then to reduce your fever. But for most people, it really shouldn't make a difference.
Got it. Dr. Sanjay Gupta with us. His podcast, Coronavirus Fact versus Fiction, available wherever you get your podcast. Listen, we've been friends for many years. I know you're in high demand. I really appreciate you taking the time to give us some perspective on all of this. And you're doing us a great service, my friend. Thank you.
Well, thank you. Pleasure. It's great to be able to reach your audience. So important right now. And, we're definitely going to get through this. But never before do I think we've been as dependent on each other, Ryan, as we are right now. So hopefully we all rise to that occasion.
And my mom wanted me to say hello on her behalf. She's listening and she's a big fan. So there you go, Mom. All right.
Right back at you. Thank you.
Take care. Thank you. See you, Sanjay.
Bye-bye.
Bye. Interesting.
Mm-hmm.
I could ask 100 questions.
Literally, like, what? Are we ever going to be able to handshake ever again? It's like, is that going to ever come back?
I know. Well, remember when we were kind of like laughing at the elbow bump?
Mm-hmm.
It was like, it was like,
now
it felt so uncomfortable. Now you don't even get. There's a guy with a 6-foot pole between everybody.
I know.
Wait, can I tell you guys? I felt guilt for days because I brought my boyfriend to an event with me, and he was
get past those statements. I still can't. Like those things still resonate and shock my organs. But go ahead.
Me too. The fact that you just say it casually.
Okay, so you have to like give when you say anything. My boyfriend, you got to give me 3 beats of delay to like reboot because I'm like going through something. Go ahead.
So I brought my boyfriend to this.
He's
to an event.
Beats.
Sorry. I know it's the same for me too.
To an
I brought him
event before all the rules.
Before all the rules. So it was kind of the day that everybody was kind of starting to. It was really like picking up. And exactly. So he started elbow bumping like my friends that I was introducing him to, and I was like, "Babe, this is embarrassing. These are my friends. Like you can hug."
I need 4 on that one. Okay, go ahead.
I said, please, these are my friends. You can hug them. You can shake their hands. They're fine. And then literally the next day, all of this like erupted. And I felt so much guilt because he was being responsible and doing the elbow bumping. And I felt so bad that I kind of bullied him into not doing that. And I like still to apologize every day to him.
You have found a responsible babe, a responsible boyfriend, a responsible man. And I like it. I like him as a part of this whole concoction. I like him as a cog in our wheel.
Yeah.
I feel like you might see him at some point in my home, considering that we go till 11 a.m.
Tubbs, how do we feed her image nationwide? How do we feed her Skype image nationwide? I want to see this. He's there?
He's not here right now, no, but he's going to come over tomorrow.
Okay. Sis, can I trust all that? Because I feel like sometimes you know.
Yeah, no, yeah. But why would I?
Well, because you guys try and keep things from me so I don't tell everybody. I know how this works.
No, I think he is coming over. Is he spending the night? I don't know.
What time is he coming over tomorrow?
Well, I don't know. I'll find out today, and then I'll let you know. But we are on the air until 11 a.m. Yeah, we're on the air until 11.
Hey, if he's coming at 12:30 tomorrow, I'm happy to extend the show. It's crazy times. Crazy times.